on the final stretch of Talk to Doc, and it's now time to take questions from our studio audience. Go for it, ma'am.
Doc, I have a question. How detailed is prenatal screening that you can detect heart disease? How accurate it is? How accurate it is?
Prenatal
or congenital screening?
Congenital anomaly scans usually done by an OB, perinatologist, and they screen everything from the brain, the head, the lips, fingers, toes, all the way down. They're supposed to be trained well enough to screen the heart, okay? But it's actually a very tedious process. It takes a lot of training to do. But if done well, we can detect up to 80% of all congenital heart diseases. It's more difficult for the heart because it's moving, and the baby is always turning around, swimming. It's hard to get good pictures. But if done well, 80% is a very good number. If in either's case, could it have been detected prenatally? Yes, it could have, but there's still a small chance of making a mistake because it's very difficult. The heart is maybe the size of a 25-centavo coin when the baby is still inside when you screen. So it's very, very small. But we have the technology, and there are good people already around in the country who can do the screening. It's just a matter of requesting for it. But of course, it'll add to the cost of taking care of the mother. But it's a worthwhile expense to know that if we have a heart disease, it will save us a lot of time for the baby, and we can treat them right away when they're born. There won't be a lag time.
So do you use an ultrasound for this or a 2D echo?
Yeah,
or what?
it's both, an ultrasound, and 2D echo is just a more specialized one. It's the same machine that an OB will use. It already has 2D echo capabilities, the new ones now, and we use the same machine. We'll screen the heart for them. We'll be able to tell you more or less right there and then if your baby is cleared from heart disease.
Yes, Doc. My question is, what are the chances in the hole in the heart will open up later on in life?
Well, after a surgical procedure, once the surgeon has closed it, less than 1% of that chance will open up. And the only reason it'll open up is initially after surgery, one of the sutures might tear, or it wasn't sutured tight enough and there's a small hole. But even that alone, over time, months or years, can close already by itself. Once we've started the process, it'll probably fix itself. So open heart surgery for congenital heart diseases are practically corrective. They're almost perfect.
Okay, next question.
Is there any way that you can prevent congenital heart disease?
Can we prevent congenital heart disease? Right now, there's no known way to prevent congenital heart diseases. But take the necessary precautions for a young woman who wants to get pregnant and have a child, that before they actually get pregnant, see your doctor so that we can correct anything that you might have and put you on vitamins, watch your diet, make sure you're not smoking at the time or alcohol intake. These small things will add up to help prevent any malformations in your baby. So yeah, please see your OB and before you plan to get pregnant. Okay.
So there is actually a way to prevent it.
Don't
smoke.
Don't smoke,
don't
no
drink
alcohol.
if you're gonna be pregnant. Diba?
Yeah. Plan for your pregnancy.
Yes.
Thanks, Dex, for that. But any parting words for our audience?
Well, in general, I'm just one cog in the wheel for cardiology. When we come and fix children's heart, I'm just one out of basically 4 groups of people, so surgery, anesthesiologist, intensive care, and myself, the cardiologist. So when we fix these patients, if they can go for surgery, it's good to remember that there is also a timing for surgery. There's a right time. If you wait too long, the good results that we expect to get diminish. So sayang yun. And then not all heart conditions are necessarily fixed by surgery. Right now, the technology today, we're progressing to types of corrective procedures that can be done without surgery. So some holes or some vessels can be closed now without surgery, which is much better.
The key talaga is to detect it early and to find out the solution early enough so that you can rest peacefully.
Yeah.
Thank you so much, Dr.
Thank you.
Cheng, for sharing with us your expertise.
Thank you very much.
And also thank you to all of you who have emailed us and for all the questions that you have asked and sent in. We will be glad to answer them and hopefully in the future episodes. Also to our studio audience, thank you for spending time with us. Thank you, Doc Oyi.
Thank you, Maricel. And of course, thank you also to our televiewers. Thank you for watching our show. Next week, we'll talk about managing your kids' weight and what treatments and therapies should be taken. So send in your questions about this topic. I'm Dr. Oyi Balburias.
I'm Maricel Laksa Pangilinan. Remember, don't be afraid to ask because we can talk to doc.